So if you're coming in for an endoscopy, keep an open mind. The staff will put you totally at ease throughout the whole procedure, and it will make the procedure go a lot easier and more successful if you're a lot more relaxed. I was referred to the department from my doctor, and then they phoned me and made the appointment. They then sent me some more information on what an endoscopy involved.
Pre-assessment has been arranged so that patients are safely prepared for their procedure. Certain patients have medication thinning the blood, or they're diabetic, that we need to make sure that their diabetes is controlled and that the blood thinning drugs are reduced so that we can take samples. We can do either phone or a physical appointment. If they do have a phone pre-assessment, they need to be available. It needs to be sat down in their own home and talk through what we're doing.
The patient information included a booklet that went through the procedure from start to finish. They basically said about they wanted to understand and know about your any medication you're on. Information also stated about when you can eat. There was numbers available so that you could phone if you wanted further information or wanted to clarify anything.
You will get a leaflet about consent, the consent process, and you'll get an information leaflet that describes what's going to happen to you.
It advised that we should wear loose, comfortable clothing, and it made it a lot easier, especially when getting on the bed and going through the procedure.
If they've got a morning appointment, they need to be nil by mouth from midnight. If they're having an afternoon appointment, they can have a light breakfast, and 2 hours before their appointment they can have a drink of water.
On arrival, went to reception, booked in. They also asked to clarify who I was, so they wanted to know my name, my address and my date of birth. And she put a wristband on. They gave all my personal information. They did tell me that if I was going to have a sedative, then I would have to have someone come and pick me up after the procedure. They then sat me in a cubicle, first of all, to wait, and then I was shown through to endoscopy. Whilst you're having the procedure, anybody that comes with you, they can't come in, and they have to either wait outside in reception or they have to come back a bit later.
The consent process is a very important part of the patient pathway. We have to gain informed consent from the patient because there are risks with the test. There are always going to be risks with any procedure you have undertaken in hospital. Consent can always be withdrawn at any time. Once you've signed the consent form, it doesn't mean that it's written in stone. Consent can be removed by the patient whenever they want.
Once you've signed the consent and you've gone through all the initial procedures, you then have to wait a while.
The waiting times, once you're in the unit, we say from admission that you can be up to 2 to 4 hours within the unit. This is because there's procedures that we cannot tell the timeline on. We can't tell how long they're going to take. So it's very hard to be prescriptive about times.
If you then opt to have a sedative, they then put a cannula in your wrist. It was a nurse that put the cannula in, and they do it all day, every day. So that made it easier, and I felt no pain or discomfort while they were doing it. I was very impressed with the way they put it in.
To administer the medication, the sedative, we will pop a little tube into a vein. It's a plastic tube that's left in. We use a needle to insert it, and through that we will give all the medication, the sedative and a flush.
The nurse comes and collects you and takes you through to the procedural room where you're then introduced to the team.
There will be on average 2 nurses and the endoscopist, which is usually a doctor or a surgeon. We'll ask them to put their belongings on a chair in the corner, have a seat up on the trolley. There's 2 ways of doing the gastroscopy. You can have sedation or and throat spray, or just throat spray on its own. If you're having sedation, you have to have oxygen, because the sedation depresses your breathing. So you'll have 2 tubes underneath your nose, and the tubes will go round your ears, and we'll pop a cuff on you and a little clip to measure your pulse on your finger.
If you're having a sedative, they connect that up to the cannula. Then you feel quite sleepy, and obviously helps you relax.
And we will spray the back of the throat to make it numb. The spray tastes particularly revolting and does a wonderful job of numbing the back of the throat. As it numbs up, it does feel really, really peculiar. It's similar to when you have an injection at the dentist. It makes you feel as if you can't swallow, you can't feel it, which is exactly what we need, and that will help the tube go down. Then we'll ask you to lie on your left-hand side and bite gently on a mouth guard. The mouth guard is going to protect your teeth from our instrument.
When they started feeding the camera down, they do it really slowly, and they're talking to you throughout the whole time. And at first it feels uncomfortable.
The doctor may pop the tube at the back of your throat and may ask you to swallow. You're not actually swallowing the tube. What you're doing is making that swallowing movement, opens up the gullet and allows the doctor to push the tube down. If you're not having sedation, this part can be a little bit uncomfortable. The first part of passing the tube, your gag reflex kicks in and you will retch. Pass it down into your stomach, and that is the worst part of the test is over.
When the camera first encounters your esophagus, you have to swallow to help it go through. But then you get used to it, and then they put the camera down further and further, and before you know it, the whole procedure's done. You may reach a bit, but once it comes out, you then get some fluid comes out with it, and but you're covered. Your clothes are protected for just in case that happens. The procedure was over before I even knew it. It only took about 10 minutes.
If you've had sedation, you're moved on the trolley into recovery. You're given time to recoup. We keep an eye on your observations. When you're recovered, we will give you a drink and some biscuits, and then we will go over the report.
After the procedure, since you've had an anaesthetic, you can't drink or eat anything for 30 minutes after the procedure. You may get some minor side effects like wind, bloating or a sore throat, but these symptoms should disappear after a few days. If you opt for sedation during the procedure, they monitor all your vital signs. Whilst you're recovering, there's a nurse that constantly monitors your progress, see how you're doing. Once you've recovered from the sedative, you're then invited to join the consultant or nurse in a room where they go through the initial findings.
We will explain what we've seen, what we've done today, what medication's required or further tests, and you get a copy of the report for you to take home for your information, and a copy of the report for you to give to your GP, plus an information leaflet. Now, the information leaflet's very important if you've had sedation. 24 hours after the test, you cannot drive or operate machinery. It's very important, and that's why we need you to be taken home with an escort. 8 hours if you've had the sedation. You can't cook, use kitchen electrical appliances, you can't go to work, you can't sign any legal documents, you can't have a bath on your own unsupervised, and you can't look after dependents.
Before you're discharged, the staff provide you with an aftercare leaflet that provides further information, and including a contact number to ring in case you're worried. So I was really impressed that they give you feedback or initial feedback right away after the procedure, which helps reassure you.
A lot of people come with preconceived ideas about how the test is going to go. It's really, really, really simple test. I know it's uncomfortable. and it's frightening coming into hospital, but be reassured that we will make you as comfortable as possible and make it as anxious-free as possible.
I would always recommend having the procedure because it can show up any problems that you may have quickly and easily. I look on that having the procedure quickly could possibly have saved my life.